Okay, in this recording, which is technically recording 3.5, we're going to cover hepatitis and cirrhosis. So first of all, let's talk about hepatitis. There are different types of hepatitis. Hepatitis is a viral disease caused by the hepatitis virus. There are different types of hepatitis viruses. There's the Hep A virus, the Hep B virus, et cetera, et cetera. And so the symptoms and the transmission is a little bit different, okay? Hepatitis A and B and C are kind of like, they're the big ones, okay? So hepatitis A, we used to call that infectious hepatitis. Hepatitis A transmission is fecal to oral, okay? And that means that somebody didn't wash their hands when they pooped, and then they prepared your food, okay? Now that you've all started gagging, let me move on and say a lot of times this is suspected. This is mistaken for food poisoning, okay? We do have a vaccine for hepatitis A now, and a lot of people, a lot of kids have had it, but most adults have not had it at this point. I know I have not had the hepatitis A vaccine. I don't know if people your age have or not. But I think it started after you guys. So, risk factors, anything that contaminates food, okay? So, a lot of times this is what causes restaurants to shut down because of a Hep A outbreak, okay? We've had a couple in the Cincinnati area in the last year that I've seen. Hep B, on the other hand, is an infected blood and body fluids, including through contaminated needles because there's blood on them, okay? You can get maternal transmission if mom has it. Mother-baby transmission, you can get that. Hep B prevents the transmission of the Hep B vaccine prevents the transmission of it. All of you have had your Hep B vaccine. It is a series of vaccines. You may have had just 3. You may have had to get 4 or 5. Generally, after like 5, they say, okay, you've had enough. You've got to be immune. So when we draw the titer. Hep B is tradition. We've eliminated a lot of Hep B at the now. So the problem with hepatitis is it's an infection of the liver, and it can cause liver failure. Okay, so all of them can. Hep C. Hep C was pretty much everybody who got hepatitis after a blood transfusion, it was Hep C, okay? We do see it in IV drug abuse as well, transmission through contaminated needles. The problem with Hep C is it's worse. More than half of Hep C cases will result in chronic hepatitis. So that means you have a chronic inflammation and infection of your liver. Hep A and Hep B don't have that, not usually, okay? So we've got a chronic thing with Hep C. Hep D. Hepatitis D, you can only get if you also have Hep B, okay? It is dependent upon Hep B for replication. So by vaccinating against Hep B, we are also preventing hepatitis D. E is another one that is fecal to oral, like A. It is only found in developing countries. So you can remember the ones that are fecal to oral by saying the vowels are in the bowels. Hepatitis G was recently discovered. We don't know a lot about that one yet. There was a hepatitis F, but they thought it was an F, but it really was just like it was really just one of the other ones, so. All right, phases of hepatitis. All right, so there are 4 phases of hepatitis. A lot of times you'll hear it referred to as phases 1, 2, 3, and 4, or you might hear them by their names. So phase 1 is when you're in the incubation period, or you're in the what we call the viral replication phase, okay? You're asymptomatic here, okay? You are contagious, or you become contagious during the incubation period. You're asymptomatic, but if we draw your blood, we're going to find it, okay? The prodromal phase, also known as the pre-icteric phase, here you start getting symptoms, okay? You get anorexia, nausea, vomiting. You get changes in what things taste like, joint pain, malaise, fatigue, hives, and itching. Sometimes, although most people get hives and itching. And some of that is due to the buildup of like liver enzymes and stuff. So, some people get, this is kind of interesting, cigarette smoke will make them sick. And a lot of times with this, they just get diagnosed with a GI bug, okay, because of the nausea and vomiting and stuff. So, at this point, their liver's not failing, not yet. So phase 3, though, at this point, now we've got some serious liver injury. We call this the icteric phase. At this point, your patient is jaundiced, okay? Their urine will be very dark because of the excretion of a lot of bilirubin. Their stool will become very pale because they don't have enough bile. And then they'll still have the GI symptoms. They'll still be tired, okay? They will often have right upper quadrant pain, and their liver will start to enlarge, hepatomegaly. And then we have the recovery phase or the convalescent phase. And at this point, the symptoms start to resolve. The jaundice gets better. The liver enzymes return to normal, okay? And so at this point, most people, you're okay. But remember, if you got hepatitis C, like 3/4 of people with hepatitis C end up getting a chronic hepatitis, okay? Now, chronic active hepatitis, this is most often with Hep C, okay? There may be some autoimmune involvement there. We're not actually sure. Fulminant hepatitis, here we have massive necrosis of the liver, okay? Your liver starts to fail within days. And sometimes this is from one of the viral hepatitis types, but it could also be a drug-induced or toxin-induced liver injury. Because remember, hepatitis itself, just plain the word hepatitis, that's just an inflammation of the liver, okay? You have to determine what kind it is. Fulminant hepatitis isn't always from one of the viruses, okay? All right, hepatitis in kids. About a third of Hep A infections occur in kids. That's why we vaccinate against that now. Most of the newborns who are born with hepatitis B that they got from mom get chronic hepatitis, and they are carriers for that. Hepatitis C is only with blood transfusions. Honestly, you will rarely see HIV from a blood transfusion, and these days you'll rarely see Hep B either these days. So every once in a while you'll see a kid end up with chronic hepatitis, but not very often. Okay, and that's because we're so good at preventing Hep B now because we give everybody vaccines, and that's the only way. All right, so eventually you could get cirrhosis. So cirrhosis is liver failure. It is irreversible. It is a destruction of the liver structure and then also function, okay? So you get fibrosis of the tissue where it just becomes stiff and it stops working. Your biliary channels, that's the channels that the bile floats down, okay, or seeps down, those get obstructed. You get portal hypertension, which is where the blood system, your portal venous system, that's all the blood vessels within your liver, so you get hypertension there because they get blocked. Because of that, the liver is often not oxygenated enough, and so you'll get a hypoxic necrosis of the liver tissue as well. We got a couple different kinds. Usually it's an alcoholic, okay? Alcoholic cirrhosis is because years and years of metabolizing the alcohol has damaged the liver cells. Those are hepatocytes, okay? Now, you can also have a biliary cirrhosis, okay? Primary biliary cirrhosis, and this is caused by, it starts in the bile ducts, okay? Primary biliary cirrhosis is an autoimmune thing. Secondary is from an obstruction. That would be if you have like gallstones, for example, okay? That would be an obstruction. This particular table that I just enlarged that you have here, it just shows you a lot of the symptoms in a nice little table and why they happen. And so I want you to pay close attention to the symptoms of portal hypertension, because everybody who has cirrhosis is going to have portal hypertension. And so these are the symptoms that we have, and we've talked about these. We have talked about these already, some of these, okay? So look back at your picture of the guy with liver failure who had ascites, and remember you could see the abdominal veins, okay? We talked about esophageal varices, why those happen. Hemorrhoids happen for the same way in somebody with portal hypertension. So take a look at that and just kind of look at the symptoms and stuff and be able to recognize those. All right, chronic liver disease, so chronic hepatitis in kids, doesn't usually cause cirrhosis, okay? But if it does and their liver fails, they will also have growth and development deficits and also nutritional deficits. Because remember, your liver is responsible for the metabolism and of a lot of nutrients. And so if they don't get that, then they're going to have nutritional deficits. With the nutritional deficits, they're going to have growth failures. And because of the toxin buildup, because of the liver failure, they're going to have developmental delays as well. Gallstones. So a couple different types of gallstones, but the most important kind are cholesterol stones. The risk factors are there. There's a thing that says fat female and 40, obesity, middle-aged females. Those are the big risk factors for gallstones, okay? Most people who have gallstones have cholesterol stones, and how do we fix it? We take out your gallbladder, okay? That's, pretty easy. If we know you have gallbladder problems or pancreatic problems, for example, if you have cystic fibrosis, you're going to be more prone to these, okay? Here's a picture of a gallbladder full of stones. So these are the cholesterol stones. They form in bile, and there's a lot of theories as to why it happens. Either you don't have to know that. All you have to know is that if somebody starts forming cholesterol stones in their gallbladder, it's going to be painful, and they're going to have to take out the gallbladder. So, if we don't take out the gallbladder, the pain continues. What kind of pain? Right upper quadrant pain and moving into the chest. Okay, so epigastric pain and mid-sternal pain. If we don't take the gallbladder out, those stones will proceed to block all of the ducts. And you can then get liver failure. More likely you are going to get pancreatitis, okay? So pancreatitis is an inflammation of the pancreas. It is literally autodigestion. Look, PowerPoint didn't recognize that word. It's right there, autodigestion, okay? Oh, look, it didn't recognize epigastric either. Okay, so with pancreatitis, you have blocked the secretion of the enzymes coming out of the pancreas. As a result of that, the enzymes literally just leak into the pancreatic tissue. And these enzymes are meant to digest all of our food so they can surely digest an organ, and that's what happens. So they get epigastric pain, goes through to the back. They'll get a fever. Their white count will go up. Sometimes it affects their blood pressure. They generally need fluids because they'll start to swell because they've got increased capillary permeability, so they'll get edema. And their fluid, they've got plenty of fluid on board, it's just not in the right place. Okay, it's all outside the tissues. It's all in the interstitial spaces. When we draw labs, we will see an elevation in amylase and also lipase, which I don't have that on there, and I apologize. But lipase is Lipase, and we've got that back when we were talking about pancreatic deficiencies in digestion, and this is one of the causes. We talked about that. Somebody with chronic pancreatitis is probably alcohol abuse, okay? So that can cause it as well. If you have acute pancreatitis because you had gallstones and we take your gallbladder out, you're probably never going to get pancreatitis again. Okay? All right, cancer. When we have cancer of the GI tract, there's a lot of things that predispose you to these cancers. We've already talked about stomach cancer being largely caused by H. pylori. So when we started treating that, we eliminated a lot of the gastric cancers. Esophageal cancer is often, we see that in smokers and alcoholics. The stomach cancer we have left is seen in smokers and alcoholics. Colon and rectal colorectal cancer. Risk factors for that include being old, but there's also a genetic one where it shows up before you're even 40 if you have a genetic defect for it, and it'll run in your family. Risk factors for that include a high-fat, low-fiber diet, inactivity. So the more active lifestyle you have, the less likely you are to have colorectal cancer. Liver cancer. Liver cancer we see in alcoholics again. Gallbladder cancer is not real common. Pancreatic cancer, also not real common, however, super hard to treat. It's often not detected until it's stage 4. And at that point, it's almost impossible to treat. All right, you've got some practice questions, and make sure you do all of these and you look at them, and your GI case study will be posted.